What do I do when a patient wants to come off their psychiatric medications, but I don't think it's a good idea? My name is Dr. Ruth Dotton. I'm a board certified adult psychiatrist, and I talk a lot on this app about the importance of providing full informed consent when starting a psychiatric medication, as well as concepts of safety prescribing. And in general, if a patient tells me that they don't want to take their psychiatric medications anymore, 9 times out of 10, maybe 4 out of 5, I am in support of that. And we're going to work together on achieving that goal. There are some cases in which the risks of someone coming off of their psychiatric medications is very high. So I'm talking about like patients who have a history of multiple psychiatric hospitalizations, either due to thoughts of wanting to harm themselves or due to psychotic symptoms or manic symptoms. If a patient's had just one episode, then it can be reasonable to taper off and see how they do without a medication. However, if the patient has a history of multiple recurrent episodes, then we know that the chance of them having a recurrent episode in the future is fairly high. So let's say I have a patient with a history of bipolar disorder who wants to come off of their mood stabilizer. They've had hospitalizations due to paranoia and agitation. This makes me very nervous. Now, in some states, there is mandated outpatient treatment, meaning that someone has to get outpatient treatment even if they don't want it. I don't live in one of those states, and even in the states in which this exists, it's really hard to enforce, and I don't think it's all that effective. Ultimately, as long as a patient understands their condition, the risks associated with it, the treatment options that are being provided to them, and what might happen if they refuse those treatment options, a person has the right to make what I would consider to be a poor decision. They have that autonomy. Of course, this is assuming there's also no acute safety risk. So back to my patient. In this situation, I would repeatedly talk with the patient about the risks of coming off of their psychotropic medications, but I would work with them on their goal. We know that if you stop the psychiatric medications really quickly rather than a slow taper, that the chance of destabilization, whether due to withdrawal effects or due to recurrence of illness, is very high. So if a patient's willing to work with me to slowly taper, then I'm willing to work with them. Of course, with each dose reduction, I'm going to review the symptoms that they should be monitoring for. So if it's a patient with bipolar disorder, then I'm worried about mania. I'm going to say, if you're noticing any changes in sleep or agitation, you start to feel paranoid, you're hearing voices, anything like that, that would be a time to go up to the prior dose and or to notify me immediately. Something I'll often do is if I think a patient is high risk, but they don't want to take psychiatric medications, we'll work together to get off, but then I'll make sure that they have an as needed medication so that if their psychiatric symptoms recur, then they can take that medication and hopefully mitigate any decompensation before it happens. Now, of course, this does require some insight on the part of that individual, and some people have this and some don't. So that's the short answer. But I'm curious for you all, what's been your experience if you've told your psychiatric prescriber that you want to come off of your psychotropic medications? What has been the response? Are they supportive? Are they against it? Do they fire you? Please share in the comments below. I'd love to hear about it.